This is the Health Group, and we are here endorsing the Malaria Consortium. Established in 2003, the Malaria Consortium is a UK-based charity that has for years worked toward the prevention, control, and treatment of communicable diseases among some of the most vulnerable populations. Its mission is to improve lives in Africa and Asia through sustainable, evidence-based programs that combat targeted diseases and promote child and maternal health. Their effectiveness in carrying out this mission is evident in their rating as one of 8 top charities by GiveWell. This means that GiveWell has independently vetted the Malaria Consortium and determined it is evidence-backed, underfunded, and able to make the most of additional donations. The Against Malaria Foundation and Malaria No More are 2 other charities fighting the battle against malaria. We chose to support the Malaria Consortium over these 2 other charities due to both their expenses outweighing the revenues of millions of dollars over the majority of the last 3 years. On account of its impressive financial health and focused range of services, we are asking for a $35,000 unrestricted gift for the Malaria Consortium. This gift would cover 0.1% of its budget for the next year and greatly help close its estimated productive funding gap of $36 million required for it to run optimally over the next 3 years.
How does the Malaria Consortium accomplish its mission? First, they recruit and train healthcare staff. They procure SMC medication, map healthcare facilities, and develop tools for reporting and monitoring the program. Staff is then trained, and the medication is distributed to health facilities. There is a dialogue with the community about the program to raise awareness and understand the community's unique needs. Data is collected via Health Management Information System monitoring. After staff are trained, they are able to distribute the medication to at-risk children. The process is supervised and data on effectiveness is collected. The medication becomes widely distributed to children in need, and the results are monitored. There is a reduced rate of malaria infection reported at health facilities. The impact of this program is that, because fewer at-risk children become sick with malaria in the first place, more children will survive. Monitoring of the program at all stages means that the results are real and demonstrable. And analysis means that the program is always improving.
So how do we know if the Malaria Consortium's mission is actually successful? There have been different research studies to test the effectiveness of seasonal malaria chemoprevention. And for example, GiveWell said that in 2017 and 2018, they conducted a survey and found out that 95% of all children received at least 1 month of the treatment, another 75% received 3 months, and then 62% of children received all 4 months of the treatment, which is the max possible. Also, the World Health Organization conducted 7 studies in areas where seasonal transmission of malaria is very high, and they found out that approximately 75% of all malaria episodes were decreased because of seasonal malaria chemoprevention. So we should definitely choose the Malaria Consortium as our charity to donate to because it gives us the opportunity to do the most good. These SMC treatments provided for our children are very cost effective. Rounded up, it's about $7 to treat 1 child for 4 months. And this means that even with our reduced price of $35,000, we will be able to do the most good and make a huge difference in these children's lives.
Those who are living in malaria-prone regions are still at risk even with current events. The malaria season will occur every year regardless of the current COVID-19 pandemic. 216 million people end up getting malaria a year, with 655,000 succumbing to the disease. We have the opportunity to directly fund life-saving preventative treatment for around 5,000 children with a donation of only $35,000. Our donor Muhammad Abul Hassan's ethos was that we should do everything in our power to focus on saving lives today. We can think of no better way of honoring his wishes than to help save the lives of children who otherwise would succumb to malaria.